had the procedure in March, and then in May you find out you're pregnant.
Right.
And they're watching you with ultrasounds and kind of seeing the progress of the baby, because you had a lot of fibroids to begin with, the progression of those fibroids and what happened to them as they're looking at them with ultrasound through your pregnancy.
Right. Out of all my fibroids, I had a total of 8. So when I got pregnant and it was time for me to go to the ultrasound, which they consider me high risk, they told me that they only seen 2 out of 8.
Okay.
So out of 2 out of 8, at first, during the first trimester, going into the second, it was the size of a grape. Then, during the second trimester, I kept asking her, well, how does the fibroids look? She was like, well, right now it's like the size of a pea. So then going into the third trimester, when they do the measurements of the baby, the stomach, the legs, the head, I said, well, do you see any fibroids? She said, no, I don't see any. So
clearly over the course of your pregnancy, these fibroids were kind of shriveling up and disappearing.
Right, they were still shrinking. And
so the baby's growing and growing big,
right,
but the fibroids are dying.
Right, so it was still made plenty of room, as we can see, for her to fully grow. I kept asking, making sure she was well developed, everything was fine. Because usually with the fibroids, it will stop certain growth with the babies. But she kept telling me, everything's fine, Miss Hill. I don't see anything. I don't see them anymore. Yeah, because you had 4 earlier pregnancies, all of which never made it because of the fibroids. The fibroids were kind of the problem. But once you had the UFE and the fibroids are out of the way, it allowed you to have a child, which is great. So I thought that alone, the procedure alone, was excellent. Because how that happened? They still just completely died off while you're pregnant. That's just a miracle right there alone. It's a miracle. That's fantastic. Like, I don't think you can get any better with that. So if you don't, if that's not a testimony, I don't know what else to tell you. Like, that's just completely amazing to me, because I was really worried about her growth. But they kept telling me, we don't see them, she's fine. Everything kept coming back with positive results, positive results, positive results. So it was nothing else for me to really worry about. So that's why I say I was able to work that Monday and I had the baby that Wednesday. Wow. And even after the pregnancy, I still feel just as good as I did after the procedure. I still feel amazing. I don't have the pressure. The frequent urine is not there. So I still feel absolutely amazing after. So yeah, I can see a big difference of me getting a procedure done, and I'm glad I did it, because it completely just changed my life as me feeling great as a woman. I was able to have a baby, able to have my daughter, and I still feel good after the pregnancy. So that alone told me that I made the best decision of my life, and I really want to thank you. My pleasure.